know this is a little bit different than a normal doctor's office, but I want you to know exactly what you're looking at when you're going over your x-rays. So after this video, the doctor will come in, he or she will go over your x-rays with you. We're not a sick care office, we are a healthcare office, meaning that we don't want to help you manage your disease or to manage your condition for the rest of your life, but we truly want to help you find and fix the cause of your problem. Now, I don't know what your experience is going to doctor's offices, but I went to a lot growing up, and the model is you go into the doctor's office, they run some tests, they give you a diagnosis, and 9 out of 10 times I was walking out of there with a bag of medications, right? I didn't know what was causing my issues. They just said, here, take this and everything will be okay. I never want you to feel that way. I truly believe that you cannot make an informed decision with your health if you don't have all of the information. And so really the goal is to help you get healthy and well now and to prevent disease, medication, drugs, and surgery for the rest of your life. But when you look at our healthcare system right now, how good of a job do you think we're doing at getting people healthy and well and keeping them healthy and well for the rest of their life? Do you think we're doing a good job? In fact, we spend more money on drugs, on medications, on surgeries, on research in this country than any other country in the world. So if drugs, medications, research, and surgery was the answer to health, then the United States should be the what? We should be the healthiest. But when you look at all industrialized countries, we rank number 37 out of 37, which is dead last. And in fact, the Blue Cross Blue Shield did a study back in 2018 where they studied 55 million of their subscribers. And what they found was that the average age of health decline used to be age 47 in the baby boomer generation, and now it's age 27 in the millennial generation. And so we have to do something different with our health. There's data to prove that although we're getting better at saving people's lives in an emergency situation, that we are actually getting farther away from health. And the biggest issue that I see is that people have no idea what true health is. Because the majority of people judge their health based on how they feel, right? It gets 3 top answers actually. Number 1 is based on how you feel. I feel good, so therefore I must be healthy. Why would I go to the doctor if I don't feel bad? Right? Number 2 is I know I'm healthy because I eat right. And 3 is exercise. But when you start looking at these, you realize how wrong this is, because if you remember the show The Biggest Loser, which the host was Bob Harper, this guy was like the picture of health. He taught thousands of people to lose thousands of pounds collectively, and he did it for years and years and years. But what happened to him a few years ago out of the blue? He actually had a massive heart attack. And so the thing that he was doing, teaching people to eat right and exercise, if that was the answer to health, then he should have been the healthiest, right? And every single month, we look in the newspaper and we see marathon runner drops dead of heart attack. So is exercise very important? Yes. Is it the answer to health? It's not. Now, number 2 is I know I'm healthy because I eat right. So if you have debilitating headaches and migraines, or you have digestive issues, or you have thyroid issues, but let's just take headaches and migraines. How much kale do you have to eat to fix the headaches and migraines? Does that make sense? It doesn't make sense because it's 2 separate things. Now, is nutrition very important? Yes. Do we teach it in our office? Yes. But it's not the answer to health. Now again, the number 1 answer that I get is I know I'm healthy because I feel good. But when you look at the top 2 causes of death right now in this country, it's heart disease and cancer. Those 2 things kill over 600,000 people every single year. The question is, how do most people find out that they have heart disease? And it's 9 out of 10 people, it happens out of the blue, they have a heart attack. They have no idea that it was coming. When you ask the person the day before how they felt, what do you think they would have said? They would have said, I felt good. I felt perfectly fine. And when you look at cancer, do we ever find out when it's too early? No, we only find out when it's too late. We can also add diabetes, high blood pressure, autoimmune issues, Alzheimer's. Right? All of these things happen when you have no symptoms. But if you want to be healthy and well for the rest of your life, then you have to know exactly what true health is. And the definition is actually embedded in the word. So what is the root word of health? What is the root word in here? The root word of health is heal. So health is not about how you feel, but health is about how your body heals. It's not about the exposure that we get. It's not about the damage that happens to our body, but it's about how our body adapts to it. Your body wants to heal if it's given the right scenario. And there's this thing called homeostasis, right? It's this center ground where our body always wants to get back to. This is normal. If we deviate from that normal, the question is, if our body can never heal and get back to the way that it was, that's where bigger dysfunction happens. And in order for you to be healthy for the rest of your life, you need to make sure that your body is healing and functioning at 100%. And if you want your body to heal and function at 100%, then you have to know what is the one organ or what is the one system that controls every bit of healing and functioning in the body. and that's the nervous system. Your brain and spinal cord control every single cell, tissue, and organ in your body. And in order for your heart to beat, in order for your lungs to breathe, in order for you to digest food, messages have to be sent from the brain down the spinal cord and go out through the nerves. Healing happens no other way. Now, if I were to take a big pair of scissors and cut the nerve that went to the heart, what would happen to your heart? It would stop, right? Same thing for every single other organ in your body. Now, if I put pinching pressure on the nerve that's going to the heart, is there any way that that heart can function at 100%? Absolutely not. And if it's not at 100%, it's at less than. And the question is that building health or disease in the long run? It could be a day, week, month, year. That organ would be building disease because it's being disconnected from its power supply. Now, what we don't realize is that through the day-to-day posture, car accidents, things that we put our body and our spine through, is that spinal misalignments can also affect these nerves. So misalignments in the spine, curvatures in the spine, the same pressure that causes pain could be the same pressure that also affects these organs. And so what we know is that the same nerves that go across the shoulder, down the arms, and into the fingertips are the same exact nerves that go to the heart and the lungs. How do I know that? When somebody's having a heart attack, where do they usually feel the numbness and tingling? They feel it along this same exact distribution. Why? It's because they share the same nerves. Now, we've all heard of sciatic pain, numbness and tingling, pain shooting down the back of the legs. Where do those nerves come from? Those nerves actually start from the low back. And the same nerves that go down the back of the legs are the same nerves that go to digestive organs, same nerves that go to reproductive organs. A lot of times, again, we don't realize that the little aches and pains, the causes of those things could be the same causes of why your body is not healing the bigger systems of the body. So we have to look at the structure of the spine in order to determine the function of your body. So everybody knows that from the front, you want your spine to be straight and you want your hips to be level. We don't want something like this because this is called what? This is called scoliosis, and research shows that scoliosis can take 8 to 14 years off somebody's life. And in the research, they talk about heart and lung dysfunction. Now, if somebody had a curve here at the top of their back and lower neck, why would they have heart and lung dysfunction? Because it's pinching the nerves going directly to those organs. So we know that from the front, you need your spine to be straight, but what people don't realize is that from the side, though, you need arcs in the spine. So you need a 45-degree arc in the neck, 45-degree rounding in the mid-back, and a 45-degree arc in the low back. And when you have these three curves, that helps your body heal and function at 100%. So we're gonna start by looking at the side view of the neck. And we're gonna start by looking at the top of the neck. And we know that the top of the neck is the most important because it's closest to the brain, and if there's a problem there, it's gonna affect everywhere below. Now, a good example of this is Christopher Reeves, Superman. He fell off a horse, and most people remember the rest of his life as being a quadriplegic. He got bucked off a horse, he damaged his top bone in the neck, and it shut down all of his muscles. But what people don't talk about, though, is he had to have a pacemaker for his heart, had to have a pump for his lungs, a colostomy bag or a pouch for his intestines, and a feeding tube, and this guy was literally on machines for the rest of his life. Now, he didn't damage any one of these muscles, didn't damage the heart, didn't damage the lungs. What was the one thing that he damaged? He damaged this top bone in the neck. It put pressure on his brainstem and shut everything down. And so that if we know that quick pressure can affect somebody's life quickly, then what can slow pressure do? The same exact thing. And that's exactly why we look at these top two lines and we want to see them equal and parallel at 18 and 18. Now, the second thing we want to see is a nice 45-degree arc in the neck. So you're going to see a number out of 45 and then a correlating percent loss of curve. And you want that number to be as close to 45 as possible. The third thing we're looking at is the forward head posture line. So we don't want your head all the way out in front of your shoulders. We want your head back over your shoulders. That's what this line is going to represent. And we want this line, this measurement, to be 15 millimeters or less. So you need to have a nice 45-degree arc in the neck. And neurosurgeons actually call this arc the arc of life because they realize that when people lose the arc and their neck goes straight, that it's the beginning of the end. And the reason why they say that is because there are spaces in between the vertebra called the discs, and these discs keep the area where the nerves come out open. And you see that these phases of degeneration here, every single phase, this space gets smaller and smaller. So what happens to the area where the nerve comes out? It also gets smaller and smaller. And what does that mean for the healing and functioning of the body? We talked about those nerves going directly to the thyroid, to the heart, to the lungs. So we know that those nerves are your lifeline. And when those nerves get pinched, it shuts it down. If we can get pressure off of those nerves and keep pressure off of those nerves for the rest of your life, that's going to keep your body healing and functioning at 100%. This is an example of somebody who's lost the curve in their neck. We're looking at a side view of the neck. The red lines indicate where their spinal alignment is, and the green line indicates where the spine's supposed to be. Now, I have patients look at an x-ray like this and say, Dr. Cody, that's not that bad. It's because on an x-ray, you can't see the neurology of what's happening in the spine. But when you look at an MRI of the same exact person, you see that this loss of curve causes pressure on the disc, which then causes pressure on the spinal cord. And if there's pressure on the spinal cord, then what else in the body is affected? Everything else. So a loss of curve is a big deal. Now, patients ask me, how does this happen? And it's the 21st century. What do we do now more than ever? We sit more than ever. We're at the computer more than ever. We look at our phones more than ever. And sometimes it's not the sudden car accident that causes the loss of curve, but it's the motions and the actions that we do every single day that can cause it. And when you look at this video, right, those actions cause your spine to become straight. It can actually go into a reverse curve, and that's when degeneration sits in. The spaces between the vertebrae get smaller and smaller. They start to fuse together. And what this represents is less range of motion, less quality of life, and less health being able to express through the nerves in your body. So now we're going to look at an x-ray version of the same exact thing. Now, this person's x-ray, looking at side view of the neck, the first thing you look at is, what is their neck doing? Is it going the right way? And what you'll see is that the neck has actually gone forward. Now, this person has got into a car accident in the past. This was years ago, but what it left was damage that stayed there because her neck is going in the completely opposite direction. And I want you to see exactly what this does. And so I want you to hold your hand up just like this in a half moon position. This is the position that your spine needs to be in order to heal and function properly. And I want you to pinch this skin where the callus is. Is it tight or is it loose? It's loose, right? So when your spine is in that appropriate position, the spinal cord and the arteries going up to your head are loose, they're relaxed. Now, what happens as that stretches out? What happens as that neck straightens out? What happens to that piece of skin is that it gets tighter. It's taut. There's tension. So when you look at this person's x-ray, is their body healing and functioning at 100%, do you think? And if it's not at 100%, are they building health or disease? It's disease. Every doctor in the world would look at this x-ray and say that this person is sick. So now you're going to see a video of what we do to help this person heal. All right, so what do you see it's different? She actually has the curve, right? Now, is she as sick as she was before, or is her body healing? It's healing, right? Now, is she 100% healed and never ever has to get adjustment ever again? No, because that's what I hear. It's like, Dr. Cody, I don't want to start going to the chiropractor because once I start going, I got to what? I got to continue to go. But the thing is, if she leaves this office and she goes back to texting, she goes back to sitting 8, 12 hours a day and changes nothing about her lifestyle, is this ever going to hold? And the obvious answer is no. And that's why every single patient gets specific home care exercises so you know exactly what to do when you're outside the office. And about 40% of the correction happens directly as a result from this home care. So the more consistent you are with home care, the faster you're going to get healthy and well. So now we're going to go through some case studies of previous patients. Now this is Jessica. Jessica had been dealing with headaches, migraines, sleep issues, chronic fatigue, anxiety, and allergies and sinus issues. When you look at her x-ray, what are some of the things that you see? What do you see there versus what you're supposed to see? We start looking at the top. We want these numbers to be equal and parallel at 18 and 18. The number's extremely high. There's a lot of pressure in her upper neck. What's happening to her neck? What's going on? Her neck's completely straight. She has 100% loss of curvature in the neck, and as a result, her head is coming way out in front, right, at 26 millimeters. So when you look at some of the things that she has going on, does it make sense? Does it make sense that somebody whose head is all the way out in front and stretched out, does it make sense that they would be having headaches and migraines? Why she may have trouble sleeping, and as a result, she's always tired? Right? If your head was all the way out in front and you lived your life like this, do you think you might have anxiety? Right? And what we know is that the nerves that go directly to the sinuses, they are also connected to the top of the neck here. So you look at this x-ray and you say, okay, that makes sense, right? She's in some trouble. Now Jessica looks at her x-rays and she says, well, Dr. Cody, I've been going to the chiropractor for the past 10 or 15 years. I don't understand how this is. I said, past 10 or 15 years? She's like, yeah. I said, how often have you been going? She's like, well, they capped me at 12 visits per year, so I split them up and I went once a month. And so I asked her, I said, who capped you at the number of visits that you could go to the doctor, the type of doctor you could go to, what the doctor can and cannot do? And what do you think she said? She said, oh, my health insurance, right? So she was judging her health based on her health insurance because her chiropractor actually said, only come back when you're in pain. And in fact, he was practicing the same model as the rest of the healthcare system, assuming that if she was out of pain, then she must have been healthy. And why was he doing this? Because he was actually going by the insurance guidelines. And this is directly from Medicare, which all major medical insurances pull from. It says that a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life is deemed not medically necessary. So in insurance's eyes, it's not medically necessary to keep you healthy and well. It's only medically necessary to keep you out of the negative. And that's exactly where Jessica was for 10, 15 years and why her spine looks exactly the way that it is. Now, Jessica says, Dr. Cody, you don't understand. Every single month I have to pay my premium. I've been paying a lot of money for my health insurance. Every month I pay $300 and I do that 12 times a year. So she's spending $3,600 just to say that she has health insurance. But as we know, before she could use her health insurance, she had to meet her yearly what? Her yearly deductible, which was $2,000 that she was out of pocket. So every year, just to say she has health insurance and to be able to use her health insurance, she's out $5,600. Now she justifies and says, well, my copay is $20 and I go 12 times a year, I'm spending $240. Every year she's out of pocket $5,800 and she's been doing that for the past 15 years. I don't know if anybody here is good at math, but that's a lot of money, right? Almost $90,000 for her health. And when you look at her health, both functionally and structurally, how is she doing? Is she healthy or sick? Is that a good investment that she's been doing or a bad investment? And I said, Jessica, you have to get out of this insurance box, out of this medical model of health and disease management. And if you want help, this is exactly what I do. But with the degeneration that I'm seeing, with the damage I'm already seeing, it's going to take a minimum of 42 visits. It's going to be about $4,500. She says, I'll do whatever you tell me to do. So we get started on the plan, and this is Jessica's x-ray 6 months later. This is at the end of her first corrective phase, and what do you see? It's different. Yeah, she's actually getting the curve back. We start by looking at the top. Those numbers are a lot closer to 18 and 18. The curve's getting there, and what's happening to her forward head posture is it's coming back. Now, what the x-rays don't show is after her first adjustment, she walked out of these doors and no longer had headaches and migraines. They were completely gone. 3 months later, allergy season came around, and her friends were saying, oh, the cedar and the pollen's so high. She says, what are you talking about? So she was able to come off her Claritin, Benadryl, and Zyrtec just like that. Now she starts sleeping better, her energy's better, and she says she feels less anxious. All right, so for her, this was a win, right? This was 6 months that she did this corrective process, and now her life is completely changed. And she was so convinced by this that she actually brought her daughter in. And her daughter at the age of 5 started to have grand mal seizures, so massive convulsing on the ground. It happened day after day after day. She was finally able to bring her into the neurologist, and the neurologist said, well, number 1, it's normal. Number 2, she's going to grow out of it and take these medications twice a day. And so she started on that path, and it wasn't until 4.5 years later that Chloe came into this office, and this is Chloe's neck x-ray. So what do you see here? What's wrong with Chloe's x-ray? That's right, her neck is going the exact opposite direction. Can you imagine the amount of tension on her brain, spinal cord, and nerves like this? This is a 9.5-year-old. And I asked Jessica, I said, how could this have happened? She says, well, it wasn't a slip on the playground. It wasn't a fall. I think it was way before that. She recalls back to the birth process. Now, Jessica was not under chiropractic care. Her hips were way off. She was in a ton of back pain the entire pregnancy. And what happened was the cord got wrapped around Chloe's neck. They had that to deal with, and they ended up using forceps and pulling Chloe out of the birth canal. And we know that in order to get the baby out of the birth canal, you have to turn the head 90 degrees and get one shoulder out and then the other. So there was a massive amount of tension and stress and pressure on Chloe's brain and spinal cord. And there were symptoms when Chloe was growing up. It was she wasn't able to latch on one side versus the other because the rotation wasn't there because of the spinal misalignment. She had torticollis where her neck was to the side like this for months. They ended up having to cut the muscle, thinking that it was a muscular issue and not a nerve issue. It was ear infections over and over. And so the signs were there, and she even took her to the child doctor, which, the pediatrician, but the question is, what pediatrician checks for this? And when Chloe got old enough, she started seeing the family doctor, and the question is, what family doctor deals with this? or looks at this. And it's not their fault. They just didn't go to school for 12 years learning about this, right? They're there for disease management to help treat the condition, and they have a drug or antibiotic for your child to help them get better in order to get them get healthier. How does that help a child heal and function better? How do medications help somebody heal better? And we know that all healing happens through the spinal cord and nerves, through the nervous system. And Chloe was given a bad diagnosis for 4.5 years of her life. So Jessica gets Chloe started, and in 12 visits, this is 6 weeks later, this is Chloe's x-ray. Chloe, from this point, no longer had any seizures. She was able to come off all medications, and when we asked her teachers actually said that she was starting to pay attention better in class. She was actually raising her hand, she was engaging, and she started sleeping way better at her house too. And why is that? Again, taking stress and pressure off of the spinal cord is helping her body heal better. Now, is this a perfect x-ray? No, it's not a perfect x-ray, but is it progress? Absolutely. And that's exactly why we take progress x-rays, to know exactly where you are in each phase of care. So this is what we get to see. Pre and post, pre and post, pre and post, pre and post, pre and post. Even something really bad like in the top right can be corrected. Now, is that weeks or months of correction? No, that's years of consistency. But with consistency, you can get the results that you came in this office looking for. So the last view we're gonna look at is a straight on view of the low back. We wanna see your spine straight and your hips level. When your spine's straight and when your hips are level, we know these nerves are well protected. These are the nerves that go down the back of the legs and cause numbness and tingling, sharp shooting pains. But the same exact nerve roots also split off and go to digestive organs and reproductive organs. So when we look at this next x-ray, this is Caroline. Caroline's Jessica's friend, a yoga instructor, somebody who is physically fit and wanted to get rid of her low back pain naturally. She had done that for years and years and years. However, she was still dealing with low back pain. She also talked about having heartburn and constipation. When Caroline looked at her x-rays, what are some of the things that she pointed out? She said, well, my left hip is a lot lower than my right. And I said, well, what is that? What is that causing? She said, well, that's causing the curve in my low back. That's where my low back pain is. I said, okay, so if these nerves are being affected in the low back, what else is likely being affected? She's like, well, that's probably causing my heartburn and my digestive issues. She's like, just let me know what I got to do to correct it. So we went to the front, went over the different tiers of care, which, by the way, there are many different tiers of care. If you just wanted to get your problem corrected and never get adjusted ever again, there's a tier for that. However, the majority of our patients continue with wellness care, so we actually give incentivized, discounted wellness adjustments right off the bat if that's something that you want to do. She's like, well, this is what I've needed to do anyway. So she continues with this corrective care. We take a progress x-ray at 12 visits through this corrective phase, and what we're seeing is that this 5.5 degree curve went down to a 1.4 degree curve just in that little time period. Now, is this a perfect x-ray? No, it's certainly not a perfect x-ray, and that's exactly why we take progress x-rays, because if we don't test, then we're guessing, and we refuse to guess with your health. So her low back pain's completely gone. In about a month, she realizes that her heartburn is no longer there, and her digestive issues are completely gone as well. This is one of the thousands of patient testimonials that we see in this office, and Caroline still gets adjusted to this day to maintain the correction that she's gotten. So this is what we get to see. Pre and post, pre and post, pre and post, pre and post, pre and post. And in order to get amazing results, I just ask 3 things of every patient in this office. Number 1 is that you're going to be spending your time, money, and energy on this. So if you're going to be spending your time, money, and energy, I just ask that you give your 100%. 50% effort gives 50% results, and we don't want to do that here. And the patients that get the best results are the ones that make their appointments, are consistent with their home care, and actually attend events in this office. You know, we are a chiropractic office, but that's not the whole answer to health, and that's exactly why along the way you will have access to resources in nutrition, fitness, exercise, detox, and mindset, and more. And so in order to get the best results in this office, we just ask that you be committed to your care. Number 2 is that if your son or daughter had 30% blockage of an artery going to his or her heart, when would you want to know? You'd want to know right away, right? So if this was your son or daughter, or your sister or your brother, or your mom or your dad, when would you want to know? You'd want to know right away, and that's exactly why we are a family first office. So for the next 2 weeks, any immediate family member that you have, we're going to take our initial exam and we're going to make it completely free. Any x-rays that he or she may need are going to be at a discounted rate, and on top of that, we have discounts for the entire family. And we have families of 7 or 8, even without insurance, that are able to afford care in this office. And why do we do that? Because family is so important. So the third thing is, I always ask, who all needs to hear about this? And the answer that I always get is everybody. Everybody needs to hear about this. And it's not only your choice for your health and your family's health that you're gonna make today, but it's also your responsibility to tell somebody that needs this. Because I do enough of these talks to know that at least one person comes to mind, whether it's friend, family, coworker, that's been dealing with these things of lifetimes of headaches, migraines, sleep issues, digestive issues, neck pain, low back pain, all these things that can be fixed and resolved, but they won't know it unless you what? Unless you tell them. And I just ask that as soon as you feel like this is a great place for somebody to get healthy and well, that you just tell them about it. And it's maybe that one sentence or that one suggestion that can completely change their life forever. So I just ask that you join our mission. And there are over 500 offices all around the country that are doing exactly what we're doing in this office. So even if you have friends, family, and other cities or states, you can get them connected to an office that has the same quality of care. So now you are master radiologists. You know exactly what you should and shouldn't see on an x-ray. So when the doctor comes in a few minutes, he or she's just gonna ask you a few questions. Number one, what do you see? Number two, what is that causing? Number three, what is that affecting? And number four, do you want to get that corrected? And if the answer is yes, that's great. We're going to walk through your plan with you, your frequency. We'll help get you scheduled, and we'll even give you a few goodies on the way out. Thanks for your time.